Welcome to Integrated Medicine Perspective. I'm Dr. Wendy Liu. Hot flashes are a common symptom of menopause in women, with some also experiencing sweating, palpitation, anxiety, and sleep disturbances. Up to 80% of women experience hot flashes during menopause. Apart from menopause, certain conditions such as treatments for breast cancer, ovarian cancer, and prostate cancer can also cause hot flashes. So let's talk about some home remedies for hot flashes. Let's start with the relationship between food and hot flashes. The most frequent observations I have made clinically is the impact of sugar and alcohol on hot flashes. Both can exacerbate the symptom. Although there isn't a wealth of research articles on the relationship between food and hot flashes, we can still find some research evidence and physiological reasoning in this regard. Diets, mainly consisting of low glycemic index carbohydrates, are linked to a lower likelihood of hot flashes. While the most probable mechanism of hot flashes is the decrease in estrogen levels, leading to body temperature dysregulation by the central nervous system, high sugar, high fat diets and alcohol can further exacerbate body temperature dysregulation through their effects on estrogen metabolism and energy metabolism. We know that not everyone with a decrease in estrogen levels experiences hot flashes, and those without hot flashes do not necessarily have higher estrogen levels than those who do. Considering the mechanism of hot flashes, they are considered a normal manifestation of menopause. However, some study findings argue for other indications and are worth our attention. Studies have revealed a consistent relationship between the symptoms of hot flashes and night sweats, especially night sweats, and the risk factors for diabetes, cardiovascular diseases, and even subclinical cardiovascular diseases. I do not believe hot flashes themselves are a risk factor for diabetes or cardiovascular diseases, but I think they are a manifestation of metabolic disturbances. Maybe the severity of this metabolic disturbance is not enough to cause symptoms by itself, but it can exacerbate body temperature dysregulation caused by the decrease in estrogen levels, leading to very pronounced menopausal symptoms, namely hot flashes and night sweats. So I think we can consider severe hot flashes and night sweats as a signal of subclinical metabolic disturbances. It is worth correcting unhealthy dietary habits, not just to improve menopausal symptoms, but also to improve subclinical metabolic disturbances. Of course, that is my personal viewpoint for your consideration. Next, let's talk about the relationship between exercising and hot flashes. Exercise itself can trigger symptoms of hot flashes, but sticking to moderate to high intensity exercises helps reduce hot flash symptoms. One possible mechanism is through improving body temperature regulation. Furthermore, we also know exercise can improve energy metabolism. Lastly, let's discuss acupuncture for treating hot flashes and how we can use the results of clinical studies at home. A randomized controlled clinical study observed the efficacy of acupuncture on hot flashes in breast cancer patients. The acupuncture group received a total of 10 acupuncture treatments at the frequency of once a week. Not only was acupuncture effective in reducing hot flashes, but its effects lasted fairly long, far beyond the course of acupuncture treatment. According to traditional Chinese medicine diagnosis, acupuncture points used for treatment may vary. Most individuals have a condition of kidney insufficiency, And a significant portion also has liver yang deficiency and the condition of yang escaping liver. Depending on each diagnosis, acupuncture points can range from 6 to 14. However, for self-administration at home with acupressure, too many acupuncture points are not practical. My recommendation is for those experiencing only hot flashes and sweating, massaging the kidney points 6 and kidney 7 may be helpful. These 2 points are both on the kidney meridians. Massage each side for 1 to 3 minutes, once or twice daily. If there are symptoms of sadness and gloominess, adding liver point 3 may be beneficial. Liver 3 is on the liver meridian. Again, once or twice daily. Overall, I highly advocate for individualized treatment approaches. For those looking to develop a personalized treatment plan involving nutrition, exercise, acupuncture, and the use of Chinese or Western medicine, it is best to consult with an integrative medicine specialist. That's all for today's discussion. Please leave comments and questions. I will see you next time.